Hi, sir. Good evening.
Hi, yeah, Soumya, 1 minute, just
Yeah,
connecting.
sure, sir.
So again, welcome for our 90-day University Prof Pre-Final Mastery. Today we are going to talk about the systemic bacteriology. We are in systemic bacteriology. Yes. So one second. Okay, we're in systemic bacteriology. We are discussing a systemic bacteriology part 4. Okay, so now we don't have time, so we're going to the next part now. Okay, we're going to start the questions. So these are the questions we have for today. You can see that it is one is the long questions on cornebatum diphtheria, other one is streptococcus pneumoniae, important topic, and of course you want to the short notes on the DPT vaccine. Yeah, DPT vaccine and its dosage schedule. And of course, C-reactive protein, and you have streptococcus virulence and strep pneumonia differences and the satellitis. Okay, these are the common questions. Okay, so I'm going to skip all these things. You know all these things about Auricle. So finally, we are going to the topic, today's topic. Yeah. So the first question, you can see the organism causing the sore throat. Yeah. So you see, this is the sore throat. So when you talk about sore throat, the sore throat is basically, other name for sore throat is basically pharyngitis. Okay, it's basically the pharyngitis. So you talk about the pharyngitis, sore throat pharyngitis, there is a list of bacteria, organisms, they told you enumerate the organisms. See, when you talk about the bacteria, the first thing you should do. Okay, so when you talk about the bacteria, the first thing you have to remember is when for pharyngitis, the most common causes would be two bacteria. So we classify them like this. One is the bacteria and other one is your viruses. Okay, bacteria and the viruses, right? Commonly. So bacteria, the most common bacteria would be your Streptococcus pyogenes. Streptococcus pyogenes. Okay, Streptococcus pyogenes, which is the group A Streptococcus, you can say. Okay, and the other one is your Corynebacterium diphtheriae. Corynebacterium diphtheriae. Corynebacterium diphtheriae, which causes sore throat. Okay. For viruses, lot of viruses. One important virus, if you remember, coronavirus. Coronavirus is very common one. Apart from that, it is your influenza virus. Influenza virus, and if it's influenza means then there will be of course para-influenza also. Influenza, then there will be para-influenza also. And if there is para-influenza virus, then the next would be your, what else can come? Your so many other viruses also, like your rhinoviruses, rhinovirus, adenovirus. So these are some common examples of your sore throat. So in fact, sore throat is most common as viruses are the most common causes comparing to this one. Okay, that's all. So now next one. Next one is you see the cornebatum. The question is directly the cornebatum diphtheria. Now cornebatum diphtheria, they asked about the morphology, excuse me, pathogenicity, lab diagnosis, and the prophylaxis. All are important only here. Okay. So now about the morphology. So C. diphtheria. Yeah, the morphology. First, we'll talk about the morphology. When we talk about the morphology, it is very, very simple and easy. You know that this bacteria, of course, first thing is it's a gram positive. It is a gram positive bacilli. It comes in the gram positive bacilli. The typical arrangement is important. You call it as Chinese letter pattern. Yeah, you call it as Chinese letter pattern. Chinese letter pattern. That is basically it's L form, C, it's like this L, C, all different type of forms. So it looks like almost like a Chinese letter only, right? Like this, and also Chinese letter, or you call it as cuneiform pattern. Okay, cuneiform pattern. So this is how it looks like this, different ways you can see this thing, Chinese letter pattern. So cuneiform pattern is another word. And the most important thing, what is important is your granules. The most important thing here, chronometrum, is the granules. So the granules which is present at the end of the bacilli, end of the bacilli, they are called as metachromatic. Metachromatic granules you call, or you call it as the Babes Earnest granule, Babes Earnest granules, okay, and phosphate granules. phosphate granules. So different names, even storage granules also. So that is very important. Okay. So these are the common things we talk about the morphology. These are the things you're going to say. Okay, that's all. Now, next one. Next one is they ask about the pathogenicity. When you talk about the pathogenicity, the main culprit, the main virulence factor here is your toxin, diphtheria toxin, right? Diphtheria toxin. So diphtheria toxin, the mechanism is very, very important. The diphtheria toxin, what is it does is, usually it goes and inhibit the mechanism of this thing is inhibits the EF2 factor. It is basically the elongation factor. It blocks the elongation factor. When it blocks the elongation factor, what happens? That leads to decreased protein synthesis. Decreased protein synthesis. So a lot of our immune cells, they're not able to provide the mediators and all. So automatically toxin will become more and can spread out, right? So it can spread. So basically it is a toxinemia. It is not the bacteria. The diphtheria disease is basically a toxinemia. Toxin is the main culprit here. Okay. And then it causes the infection. So when it causes the infection, it causes different, this one, by the toxin goes and causes different type of organ it affects. So what are the common things it causes? So first of all, the first one is faucial. There is faucial type, and then you have the laryngeal type, and then the systemic type. These are the three types. Okay. Faucial type is basically what happens is that you should know very well that faucial is basically in the pharynx. You should affect the pharynx or throat, and it leads to which membrane? Remember, it causes pseudomembrane. It leads to pseudomembrane. And because of the pseudomembrane, the bleeding, if you try to remove it, the bleeding will be seen positive. That's what it is, pseudomembrane. Okay. Now that will give a special appearance of bull neck appearance. Bull neck appearance. So bull neck appearance is characteristic in this faucial, and this is the most common type, right? Laryngeal, again, the most dangerous type, because when there is larynx means it leads to most danger because it leads to obstruction. So obstruction of the respiratory tract, right? Obstruction of the respiratory tract. That's what it is, the most dangerous type. The membrane can go and block your larynx, so they can have most dangerous type. Systemic type is basically systemic infection toxinemia. So it causes what? Cardiotoxicity. Not only cardio, neuro, anything, but usually patient goes into cardiotoxicity, and that can lead to death, grave. More, the prognosis is very, very bad. So this is about the pathogenicity and clinical features. Okay. Now about the lab diagnosis. When we talk about the lab diagnosis, so it's like this. Lab diagnosis, you should know that. So very, very important. So what happened? First one, you will go to the gram stain. Different type of first, always I told you're talking about the microscopy. So one is the gram stain, and then we have a special stain also. We have to know that special stain. Okay, special stain. And then comes your culture. We have different type of cultures. Yeah. And then for toxin detection, there is something for toxin detection. And there is some sensitivity test also. Sensitivity test, skin sensitivity test. So everything is important. So just 5 points you're going to write here. So when you talk about this one, gram stain, in gram stain, what you're going to see, you will be seeing the gram positive bacilli, just the gram positive bacilli in Chinese letter pattern. In Chinese letter pattern, right? That is your gram stain. When a special stain, the special stain name is called Albert stain. Albert stain, this is very important. You have to mention it. Yeah. In Albert stain, what you see is that you will be seeing in Albert stain, you will be seeing a green bacilli. Green bacilli into Albert stain, green bacilli with blue or black metachromatic granules. Metachromatic granules. Okay. So it will be like at end, you will see like this. And this will be connected with the bacilli, like this green color bacilli with N, different. Okay. Same in a Chinese letter pattern. Now culture. When you talk about the culture, we have two cultures. Culture, we have the selective media and enrichment media. Enrichment media, right? Selective media and enrichment media. We have two medias, enrichment and selective. When you talk about the enrichment media, what is for a selective media? The most one is, it's a potassium telluride, potassium telluride agar, potassium telluride agar, okay? Or Tinsdale media, we call Tinsdale media, okay? Potassium telluride and Tinsdale media, selective medias, which almost take 24 hours for growth. Enrichment media, we're using a special media that is your, if you remember, which we call it as the low-flux serum slope. Low-flux serum slope. That is basically LSS media. We call it as LSS media. Okay. So here the growth will be available within 8 hours. You can get it. Okay. That's what it is. Enrichment for quick, you do low flux. For selective media, potassium telluride or Tinsdale media. Okay. Tinsdale. This is, yes, Tinsdale telluride. Okay. Telluride. Okay. Now toxin detection. For toxin detection, there is some precipitation test called. We call it as the Alec gel precipitation test. Okay, so basically here nothing, it is just a toxin antitoxin reaction only. You're checking for the toxin antitoxin reaction. That's it. Okay, nothing much. In skin sensitivity, this is check called Schick test. Schick test is basically to check the susceptibility of diphtheria. We don't do it much, but for examination you're trying to check the susceptibility of diphtheria disease, to check the susceptibility of diphtheria. That's all. This is for the lab diagnosis. Okay. So we have done with this. Then they asked a prophylaxis. For prophylaxis is very simple. You're going to talk about this vaccine now. Prophylaxis means there is only one thing, that is your DPT vaccine. DPT vaccine we give in IM form, and you know it's the 6, 10, 14th week, and followed by that you're going to give at 2 years, at 2 years once, and then at 5 years once, and later this is first dose, second dose, third dose, fourth dose, fifth dose, then at 10 and at 16-year booster. Okay, 6, 7. So total 7 doses. You're going to give total 7 doses. DPT vaccine. That's it. This much only for prophylaxis. Okay. The strain name is Park-Williams strain. That's okay. They will not ask here in this much. Okay. So fine. So now our next question. Our next question will be, so explanation, everything is given. You can go through it nicely. All the media's pictures, everything is given. I'm running a little bit so that we are late actually. So I have to finish the topic. So Streptococcus pneumoniae. When you talk about Streptococcus, see here, before pneumonia, the first question is pneumonia causing. First of all, pneumonia. When you talk about the pneumonia, pneumonia is usually caused by, we can classify pneumonia into two. One is your community acquired pneumonia, and other one is the hospital acquired, right? Hospital acquired pneumonia. Hospital acquired pneumonia. Okay. So here in community acquired pneumonia, again, we classify them into bacteria, most common, and also viral. In hospital, it's mostly bacterial only. Okay. So now, what are the list we have? So the list goes in the bacteria. You know the most common is Streptococcus pneumonia or pneumococcus. Streptococcus pneumoniae, the most common cause of community-acquired pneumonia. Also your Mycoplasma pneumoniae. Also your chlamydia. These are community-acquired pneumonias, commonly causing. Okay. And of course, your H influenza. Also, you can add H influenza. And viral, same. You know that the same thing. Your influenza virus, your coronavirus, and respiratory syncytial virus. These are the common viruses. Okay. When you talk about hospital-acquired pneumonia, the most resistant type, all the resistant bacteria, which are very resistant to antibiotics. So that means, which are they? They are your Acinetobacter, and comes your Klebsiella, Escherichia coli, Pseudomonas.
Just to confirm, you'd like to call Samia. Okay, I won't do it. Who do you want to call?
Yes, okay. So resistant Acinetobacter, Klebsiella, Pseudomonas. These are the hospital-acquired pneumonia, which is bacteria-related. Okay. Now, next one is Streptococcus pneumoniae. So our main organism now is your Streptococcus pneumoniae. Okay, Streptococcus pneumoniae. Okay, Streptococcus pneumoniae. Here in Streptococcus pneumoniae, what we have is, yeah. So first question is, write the morphology. When you talk about the morphology, so you know that one. This is a diplococcus. It is a diplococcus. It comes under the diplococcus. Of course, gram-positive diplococcus, which has lanceolate shape. Lanceolate Lanceolate means like this, okay? Lanceolate shape, diplococci. Okay, and this is the morphology. So diplococci with lanceolate shape, that's it, morphology. Now when we talk about the pathogenicity and virulence factor, pathogenicity and virulence factor when you talk, yes. So what are the most important things, sir? The most important is the capsule. Capsule is important, and of course, IgA protease. Protease A. Okay, these are the most important virulence factor. Because of the capsule, you know the risk of infection. If the capsule is one of the main virulence factors. This is the main virulence factor. IgA protease, another one. Next one. Okay, so they both are the reason that leads to a lot of diseases. So what are the diseases it causes? When you talk about the diseases, so what are the diseases it causes? It causes at least 3 important diseases you must be knowing already. One is your pneumonia, which we are talking now. The severity is very, very bad, pneumonia. Second one is your meningitis. Remember, overall, most common cause of meningitis. So it is the most common cause of community pneumonia, community acquired pneumonia. Most common cause of meningitis, overall meningitis or adult meningitis. It's a bacterial cause, and also it causes, if you remember, epiglottitis, like Haemophilus influenzae. Also, it causes otitis media. Most common cause of otitis media also. ENT diseases, okay, most common cause. So these are the classic diseases which Streptococcus pneumoniae is causing. Okay, the risk factors. Now, who are all under risk? The risk factors are usually people who have splenectomy, right? Who doesn't have any spleen. So after splenectomy, they can get alcoholic patient, alcoholism, other HIV patient, steroid. I mean, any immune decreased patient, they are very high chance of getting the Streptococcus pneumoniae. Okay, now, so these are the things. So treatment. So treatment, if you see, basically we give, if it's oral OPD basis, oral amoxicillin is fine. Oral amox we give. If not, penicillin is very good. Penicillin injection form, penicillin IV, it also gives a very good program with strep pneumonia. It works very well. This much only for the Streptococcus pneumonia. Now, we have other question. Yeah, they actually in question they haven't asked about the diagnostic part, but okay, we can do that also because that's an important part only, diagnostic part. When you talk about the lab diagnosis of strep pneumonia, the shortcut to remember is very, very easy. You remember it as like this: BIO, bio. One is bile solubility. This can be objective question also. That's what we are stressing. Bile solubility test positive, and then you have inulin fermentation positive, and other one is optogene sensitivity positive. Okay, that's all. This much only. Right. Now, next. So everything's explained here. You can go through this one. Okay. All the points are mentioned here clearly, you can see. Now, short notes on the DPT, diphtheria, pertussis, and tetanus toxoid. Okay, so vaccine and dosage schedule, all those things. Very, very important. Yes, you should know. DPT. So when you talk about DPT, the first thing you should tell about the vaccine. So DPT is basically containing diphtheria plus a diphtheria toxoid. Then we have the pertussis whole cell vaccine. And then, of course, you have tetanus toxoid. TOXOID, toxoid. So now what happens is pertussis? Pertussis increases the immunogenicity. Pertussis actually increases the immunogenicity of the DT and TT. Okay, that's it. That's the function of pertussis here. Okay, now, first one. So now, what is this one? This is usually this vaccine dosage. So when we give this dosage usually depends on, according to National Immunization Schedule, we have 6th week, we just spoke, 6th week, 10th week, 14th week, we are going to give. And then between 12 to 24th month, that is exactly 2 years once you give. And then 5th year, 5 year you give once. And then 2 boosters. That boosters would be one at your 10 years, another one at 16 year. booster. That's it. So total 7 dose. So total 7 dose. We already spoke about it. And the route is the route of administration you're going to give IM route. IM route. IM route is the best route for this one. Okay. Now, usually the vaccine must be stored at the normal 8 degrees Celsius. Okay, it should not be this thing. Only at 8 degrees Celsius is sufficient. No need to keep it in the refrigerator. Okay. Okay. So this is 8 degrees Celsius. So yeah, contraindicated. Usually contraindicates the side effect. The side effect of the vaccine is when the whole cell is used, it can cause severe cause brain affects. We call it as encephalo genetic. Encephalogenetic means it affects the brain and it can cause seizures. Okay, so that's what for which of the patient it is contraindicated. Yes, for which of the patient it is contraindicated means patient who is allergic to this vaccine, number one, and second one, patient who has any encephalopathy, patient who's having any encephalopathy. For these two patients, it is contraindicated. That's it. This much only you should know. Okay. IM, usually remember, you're going to the anterolateral part of thigh muscle. That's it. This much. Okay. This is your DPT vaccine explanation. That's all. Okay. So we're done with this. So here I have elaborated it more. You can, some extra points also have been given. You can go through it, but whatever if I told you, right, that is more than enough, sufficient enough. Okay. Yeah. Now, next, C-reactive protein. What is C-reactive protein? C-reactive protein, usually you would have seen in your lab test, you must have seen frequently this word is coming. CRP, C-reactive protein. So C-reactive protein, basically, it is an inflammatory marker. Inflammatory marker comes under ARP, acute protein reactants. Okay, it is basically, I'm going to write it here. Okay, acute phase reactant. Okay, acute phase reactant, APR, or doesn't matter, acute phase reactant. Okay, acute phase reactant. So what happened? This is the inflammatory marker. They usually increase in any infection or inflammation. First of all, why this name came? The C, because it causes usually what happens, it precipitates with the C carbohydrate antigen of which one? Streptococcus pneumoniae. This one more question also. Streptococcus pneumoniae. Okay. So usually it goes across. It has this precipitation reaction. That's what. Not any other thing, antibody, anything. Just precipitate with the streptococcus. That's what we have this one. So now, what is the normal range? Normal should be always, remember, it should be less than 0.2 milligram per dl. This should be the normal value. But if it is rice, so the rice can be mild rice, or it can be moderate rice, or it can be extreme or marked rice, you call extreme rice. So mild rice means it is 0.2 to 1. So 1 to 10 will be moderate. More than 10 would be the extreme rice, right? So mild rice, usually you can see whenever the patient is normal cases also. You can see it in the normal cases, like if patient is, you're doing exercise, pregnancy, these cases. Moderate right usually happen some inflammatory reactions, like example, when there is bronchitis or pancreatitis. All this is normal or any inflammatory conditions. Extreme rise will happen when there is infection, especially bacterial infection. This is the main thing. So extreme rise means you will be thinking about some bacterial infection should be there definitely. Okay. So this is what the interpretation is for. The CRP value interpretation. This much only. Okay. So these are the things you have to remember when the C-reactive protein asks. Usually it's inflammatory mediator. C means what? What is the normal value and how it is significant for us. Okay. There are a few other more examples as we given. You can go through it also. It's here. Everything I mentioned, even myocardial infection also, everything's clearly mentioned here. Okay. Yeah. And there's something, yeah, how do you detect CRP? CRP, you do another, yeah, important things which I forgot. CRP is usually did with latex agglutination test. Okay, that's the common method for detecting it. And also we have highly sensitive C-reactive protein, which is basically for cardiovascular diseases they are using as a marker. Okay, that's all. Now comes your Streptococcus viridans, strep pneumoniae. Yes. So if you remember, in previous classes, we spoke about it. When you talk based on the hemolysis, alpha hemolysis, excuse me, alpha hemolysis on the blood agar plate, there were two things. One is the Streptococcus viridans, and other one is the Streptococcus pneumoniae. Okay, what are the differences? The differences are, first of all, both are gram positive only, but this is gram positive cocci in chains. Viridans group will be chains. It causes infective endocarditis, if you remember, subacute. Here it would be in pairs. So this is gram positive cocci in pairs. That is lanceolate shape. Lanceolate shape. Okay, number one. Shape. Gram positive. Okay, next. How do in blood culture, in blood agar, if you grow, you see the minute colonies. The colonies will be very minute, nothing specific. But here, what happened in your Streptococcus pneumoniae, the colonies are looking like a carom coin. Sometimes they also call Droughtman's colony. Droughtman's colony. This question will be asked 1 mark also. Carom or Droughtman's colony. Okay, here it's a minute colony, that one. Okay, apart from that, here there is, for viridans, there is no any other specific test and all. Here for your step capsule is absent here. There is no capsule, but here capsule is present. Apart from that, there is 3 important tests, as I told, BIO test. B for bile solubility, I for inulin fermentation, O for optochin. These 3 things are positive for your Streptococcus pneumoniae alone, not for this one. This will be negative here. These tests will be negative here. Okay, so this much only. Very, very simple. But just 4-5 points, you'll get full mark. So you can't miss this also. Okay, right. Now next one. Next one, you can see here. Yeah. So to differentiate the viridans and the Streptococcus pneumoniae, how do you differentiate these two? Everything is given. You can see we have spoke all the things here. Right. Yes. Now, last question is your satellitism. Very simple and easy one. Satellitism, first of all, they should draw the diagram. Before going to diagram, with the few points important. Satellitism is shown by which bacteria? Haemophilus influenza. Haemophilus influenzae. First one. So what happens is that normally when you grow it in the blood agar plate, when you try to grow this in blood agar plate, so normally it needs the V factor in blood agar. The H influenza needs V factor for growth. So when you add Staphylococcus aureus, bacteria, H influenza's friend, you can say H influenza bacteria, this will give the V factor. That will increase the growth, enhance the growth of your H influenza, Haemophilus influenzae. This is the rule. Okay, Haemophilus influenzae needs V factor for growth. So Staphylococcus aureus give the V factor to enhance the growth of the H influenzae. So now, how this is interpreted? I will write it here now. The picture, they told to draw the picture. So you're going to draw a round blood agar. This is your blood agar. Okay, this is a blood agar plate. Okay, and then in the center, you're going to put a streak, which is, this is your Staphylococcus aureus streak. Okay, you're going to write it here, Staphylococcus aureus streak line. And surrounding here, you would have streak the H influenza. Now the growth of the bacteria will be, write it here. Yeah. Let me use this color, different color. Yeah. So here you can see like this. Big colonies will be there near to the streak line. And when you go further away, the colony size will go down. So this is what it is called. So these are the Haemophilus colonies. Haemophilus influenza colonies. So because When it is close to Staph aureus, the size is bigger, enhanced. But when you go further, the size will go down because it's not getting V factor. So this is the picture. If they ask the picture, you can draw and label it. This is a blood agar. Okay, this is a blood agar plate. In blood agar plate, you're putting a Staph aureus streak and H infancy, and you see these things. This is a satellitism. It looks like a satellite. That's what we call it as satellitism. Okay, that's all. This much only. Very simple. A short notes. Easily you can get the mark also. Okay, not a big deal. So everything is mentioned here. Even the picture is here also. Another picture I mentioned here. You can see this picture and you can satellitism. Okay, that's all. This much only. So we have done for today's class. We finished by time. Yeah. So okay. So go through it, and if any doubt is there further, we can discuss. Okay. Good evening for now. Soumya, I will leave now, okay?
Uh, okay, sir.
Yeah, I'll leave now, okay? Yes.